Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kaschiduk Bhag Bhavet, Om Shantihi, Shantihi, Shantihi. Meet Pitarbai Maratha, a 60-year-old manual labourer who lives in Kasdol, Chhattisgarh. For her, strength and hardship were a part of life. A few months ago, she noticed that her energy was low and her weight had dropped. Not unlike many, Pitarbai blamed these symptoms to her age. It was during the active case finding campaign that she realized that she had some of the most common symptoms of tuberculosis. She was given free testing under the National Tuberculosis Control Program, which confirmed her disease. Since the commencement of her treatment, her health has improved. She has resumed her work and lives a life of dignity and wellness. There are millions of stories like hers in India, stories of pain and suffering that have been transformed into stories of hope and progress. The estimated number of new tuberculosis cases in India number at around 2.8 million, and the estimated mortality rate attributed to TB is 420,000. 40% of whom have a latent form of tuberculosis. It is apparent that tuberculosis is a major obstacle in India's development goals. To combat this issue, the Indian government, under the leadership of Prime Minister Narendra Modi, has spearheaded various invigorating and radical reforms to ensure that India is TB-free by 2025.
दुनिया भर में टीबी को खत्म करने के लिए वर्ष 2030 तक का समय तय किया गया है। लेकिन मैं आज इस मंच से ये घोषणा कर रहा हूं कि भारत ने वर्ष 2030 से 5 साल और पहले यानी 2025 तक टीबी को खत्म करने का लक्ष्य अपने तय किया है।
The program has developed many new initiatives. Under these initiatives, policy has been set in place to ensure that every new case of tuberculosis is notified by both public and private healthcare providers by using the online surveillance and registration platform NICSHARE. To further secure the continued support of private healthcare providers, incentives are being provided for the notification and completion of treatment for patients diagnosed with TB. Under the NICSHARE Poshan Yojana scheme, patients treated with TB are provided with a direct benefit transfer (DBT) of Rs 500 a month till treatment completion for their nutritional support. To ensure quality and prompt diagnosis of TB all across the country, this program has deployed 16,574 microscopy centers, 1,180 CB-NAT laboratories, 78 culture and DST laboratories, and 400,000 treatment support centers have been established at the village level. More than 20,000 handheld devices have been distributed to field staff to ensure timely notification and completion of treatment for people diagnosed with TB in even the most remote and hard-to-reach areas of the country. This, along with the use of mobile vans and active case-finding missions in vulnerable areas such as prisons and urban slums, have led to the acceleration of TB notification with 2.1 million in 2018. Under the Make in India initiative, the program has also adopted the indigenously developed TrueNAT molecular test in an effort to maintain the program's goal of the early detection of tuberculosis. To ensure that no undue restraints are placed upon those suffering from TB, the program ensures that fixed daily dose combinations of TB drugs are provided free of cost. Over 1.5 million patients have initiated the Daily Regimen Fixed Dose Combination (FDC) for treatment of TB. To continue the fight against drug-resistant TB, the program has introduced a shorter regimen of drugs and a newer drug regimen containing delamanid and bedaquiline. Due to these initiatives and policy decisions, treatment success rates have tripled from 25% to 83%, whereas TB death rates have come down from 29% to 4%.
TB is a disease with widespread social and economic ramifications. If we keep the patient and the community at the center of our strategy, only then can we succeed.
In order to reduce the number of new TB cases across the country, the program has established a myriad of preventive measures such as health education drives regarding cough etiquette and the proper disposal of sputum of those infected with TB.
Every year, about 2.8 million people in our country are affected by TB. Toward this, we have set up national, state and district level TB forums.
The cornerstone of any public health program is community engagement and their active participation. To this end, TB forums have been constituted at various levels to achieve public awareness, to eliminate stigma and remove discrimination around tuberculosis. It is now apparent that tuberculosis is not a local nor a national problem. It is one of global proportions which affects humanity as a whole. To combat tuberculosis, we must seek it out where it exists by applying international standards of diagnostics, treatment and prevention. Through the dedicated efforts of field staff and administrators, India will remain at the forefront of the global fight against TB.
The entire health machinery is working to fulfill this commitment. We have begun implementing our ambitious NSP, National Strategic Plan, and will provide whatever resources are required for India to end tuberculosis.
Although the road ahead us is long and paved with difficulties, with the unwavering will and ardent support of the Indian people, we will make India TB-free by the year 2025.
TB हारेगा, देश जीतेगा।